Her hands were raw. I watched her use hand sanitizer 4 times in 5 minutes.
He couldn't focus. He was so worried he had forgotten to check the stove.
She told me she kept having horrible thoughts, thoughts that she should hurt her family, and she counted backwards to make them stop.
Every time she drove over that speed limit, she thought she ran someone over. She backed up, got out and checked, and got back in the car. She never made it to work.
Medical providers often meet people who are experiencing untreated mental health conditions. Some of these may be mild and hard to see, and others may be more severe, obviously disrupting a patient's life. Obsessive-compulsive disorder, or OCD, is a disorder of both thought and behavior that can significantly impact functioning and quality of life. Patients with OCD have obsessions, unwanted, intense, and repetitive thoughts that become distressing because they make it difficult for a person to concentrate, complete tasks, or manage relationships. These thoughts often focus on health, germs, or safety, but can be about anything. In most cases, people develop compulsions or ritual behaviors that help cope with the distress of the obsessive thoughts. Common compulsive behaviors include household cleaning, body cleaning like washing hands, checking for safety such as turning the stove off or locking doors, or language repetition such as rewriting or repeating a phrase. Obsessive-compulsive disorder can create tremendous distress in a person's life. The good news is there are evidence-based treatments that can greatly reduce the symptoms and distress of OCD. Cognitive behavioral therapy, or CBT, is a treatment that addresses both problematic thoughts and subsequent behaviors. Someone can learn how to challenge the thought, "I must wash my hands right now to keep the germs away." CBT is often a time-limited treatment and focuses directly on specific problems associated with OCD. Exposure and response prevention, or ERP, is a specific kind of cognitive behavioral therapy that helps people identify their obsessions and postpone compulsive behavior. For example, a patient may be asked to touch an item like a doorknob and then delay hand washing or sanitizing. Eventually, this experience readjusts how people think and what they do in relation to common activities, such as opening doors. Medication is often used to treat the symptoms of OCD and can be especially effective in combination with ERP or CBT. Medications for OCD include some of the selective serotonin reuptake inhibitors, or SSRIs, which address symptoms of both depression and anxiety as well. Obsessive-compulsive disorder can consume patients' lives, but with evidence-based treatments, people can greatly reduce their symptoms and go on to recover. After all, intense thoughts and coping behaviors are a part of life. But with good, evidence-based care for OCD, obsessions and compulsions don't have to be.